A previously healthy 21-year-old man is brought to the emergency department for the evaluation of an episode of unconsciousness that suddenly happened while playing football 30 minutes ago. He was not shaken and regained consciousness after about 30 seconds. Okay. Over the past 3 months, the patient has had several episodes of shortness of breath while exercising, as well as sensations of a racing heart. He does not smoke or drink alcohol. He takes no medications. Vital signs are within normal limits. On mental status examination, he is oriented to person, place, and time. Cardiac examination shows a systolic ejection murmur that increases with Valsalva maneuver and standing, and an S4 gallop. Okay. The remainder of the examination shows no abnormalities. An ECG shows a deep S wave in lead V1, tall R waves in lead V5 and V6. Okay. Echocardiography is most likely to show which of the following findings. So let's see. So again, said deepest wave in V1 and tall R waves in V5 and V6. So this is hypertrophy. This will be right ventricular hypertrophy. Maybe this is even like hypertrophic cardiomyopathy, or this is definitely hypertrophic cardiomyopathy. So this is the abnormal movement of the mitral valve, symmetric left ventricular wall thickening, bicuspid aortic valve ventricular septum defects, mitral valve leaflet thickening, reduced ventricular ejection fraction. So it's basically between A and B. In HCM, the hypertrophy is usually asymmetric. So I will go with A because of the way the hypertrophy is, particularly ventricular septal hypertrophy. Because of that increased thickness, we are going to have kind of like a flailing motion of the mitral valve, something along those lines. So let's see. Yeah. So yeah, diagnosis of HCM is the most likely cause of this patient's presentation. Can be confirmed by echocardiography, which typically shows systolic anterior motion of the anterior mitral leaflet here. Then we have asymmetric septal exactly. So this one is more typical for older people, whereby hypertension results in symmetric left ventricular wall thickening. We'll check that a little bit later. Let's finish reading this. Asymmetric septal hypertrophy and septal wall thickness of greater than 15 millimeters. Doppler echocardiography can reveal increased left ventricular outflow tract pressure gradients. Let's see this. Okay. So this is the interventricular septum. It's hypertrophied. Yeah. And let's see this one. I said it was for an older person. So symmetric left ventricular wall thickening can be seen in restrictive cardiomyopathy, which may manifest with palpitation, dyspnea, and syncope. However, this patient lacks other typical findings of restrictive cardiomyopathy, such as orthopnea, paroxysmal nocturnal dyspnea, increased jugular venous pressure, and peripheral edema. Furthermore, this patient's presentation and ECG findings are more suggestive of HCM, but they didn't specify. But basically, this is more, it's going to be in older patients that have, hypertension.